There is a sense of pride in our history. Certainly that history becomes more infused in you the longer you've been here.
People came from all over the world for surgical procedures.
When market forces push us in various ways, we try to maintain this patient-centered approach.
Near the corner of Brookline and Longwood Avenue in Boston sits one of the world's most vibrant, modern, and trusted healthcare facilities. Beth Israel Deaconess Medical Center was born from 2 hospitals, each rich in history, each known for its compassionate nursing, each renowned for its medical discovery. It began with the vision of Methodist deaconesses. The goal was to plan a hospital where science and Christian kindliness should unite in combating disease. The New England Deaconess Hospital opened its doors in 1896, a modest facility, just 14 rooms, located in a 5-story brownstone.
These deaconesses were very socially conscious ladies whose idea it was to help people of every creed and religion in need of medical care.
From nursing orientation on, it was the deaconess started this hospital to take care of all comers, and that was pretty much infused into our core.
By 1907, there was a need for expansion, and it came in the form of a 50-bed facility just off the Riverway in Boston. Here, some of the finest doctors and nurses practiced, including surgeon Dr. Frank Leahy, and Dr. Elliot Jocelyn, who would become the foremost expert on diabetes care. In 1922, the first administration of insulin in New England would occur within these walls.
Back in those days, diabetes had to be treated with just diet. People had to lose weight. That was the only way. You had to go on calorie reduction diets in order to decrease the blood sugar. There was no insulin. Dr. Jocelyn was the first person in New England to use insulin.
Meanwhile, not far away in Roxbury, another hospital was serving a growing Jewish population.
At the turn of the century, there was a huge exodus from Europe of Jewish refugees, many of whom settled here in Boston. And so the community realized that there had to be some place where they could feel comfortable.
At the 45-bed Beth Israel Hospital, Jewish immigrants could find Yiddish-speaking caregivers and kosher meals. But much like the Deaconess, its charter was inclusive, offering medical aid to persons of any creed or nationality. By 1928, the need for a larger medical facility became clear. 5,000 people attended the opening of the new $3 million building on Brookline Avenue, just a few blocks away from the Deaconess. Reviewers hailed it as the most modern-equipped Jewish hospital in the country, a phone jack at each bedside, and a private bath for every 2 rooms. Across the street, the Deaconess was growing again too, founding Palmer Memorial Hospital, dedicated to the treatment of cancer. Named after Jenny Palmer, who had died of cancer, the hospital did what many others would not. It accepted those with incurable cancers, caring for them through their final moments.
My first nursing assignment was the Palmer building. Patient care was always number one. Teamwork was always very important.
While the Deaconess had established itself as a specialty hospital for surgery and cancer, Beth Israel was moving in another direction, teaching and research. In 1928, it entered into an affiliation with Harvard Medical School, sharing its expertise with medical students.
I don't think that this hospital would be anything like the important hospital it is in Boston and across the nation with a national reputation without the Harvard affiliation.
The federal government funded research on defense-related medical issues, including the study of shock. In 1944, Beth Israel took part in a nationwide program to test penicillin. But one of the most significant research accomplishments came from a man who believed electrical current could be used to make the heart beat effectively, Dr. Paul Zoll.
He was not physically a large man, but he carried a lot of weight. He knew what he wanted to do. He worked very hard, and his patients adored him.
In 1960, Dr. Zoll's invention, the cardiac pacemaker, was implanted for the first time into a patient at Beth Israel. Doctors would come from all over the world to learn the procedure. Over the years, both hospitals pioneered a long list of medical firsts, including the first written statement on the rights of hospitalized patients in the nation, the first successful liver transplant in New England, and the delivery of the first baby conceived through in vitro fertilization in Massachusetts. In 1996, after a 50-year history as neighbors, Beth Israel and the Deaconess merged. Today, nearly 250,000 patients are served each year by more than 1,200 physicians, most whom hold faculty appointments at Harvard Medical School.
Cancer research, vascular biology research, transplant, diabetes, I think these are some of the big areas where we've concentrated on and have world leaders in all of these categories.
Today's Beth Israel Deaconess Medical Center has strong affiliations with a number of inner-city health centers, community hospitals, and specialty clinics. As one of the top 4 recipients of biomedical research funding from the National Institutes of Health, BIDMC researchers run more than 200 clinical trials.
I have to be very proud here. We've always had magnificent nursing care. We've always had leadership that understood what the mission was.
The whole idea was to provide care for needy people. It was a patient-centered kind of approach even 100 years ago, and that culture sort of carries through.
Caring, wanting to work with people, wanting to communicate with people, wanting to help others.
It is indeed Harvard with a heart, and I think this is true of patient care, and I think it's true of research and what motivates people.
At the center of medicine, at the heart of caring. This is Beth Israel Deaconess Medical Center.